Sociocultural Issues, Chapter 4. Learning Objectives for the chapter. Culture can be defined as a learned pattern of behavior. Culture shapes our thinking, and it also is the basis for our life structure. Spirituality and religion both have values that are important in one's life and can be seen throughout different cultures. Individual belief systems can be found within a culture's political, social, and religious practices. When considering culture, if the individuals believe in the treatment as well as the care of their providers, successful outcomes are far more frequent. When understanding stereotypes and prejudice, it is important that any healthcare provider understands their own thoughts related to race, ethnicity, religion, and social stereotypes and other prejudices. Because an individual's behavior does not necessarily represent a culture, when their actions go beyond a cultural acceptable point, that is when someone would be considered as eccentric or deviant from the cultural norms. Western medicine is based on scientific treatment methods. And if something cannot be explained through the scientific method, a physician, for example, will disregard that information. Considering folk medicine, this embodies actual practices, beliefs, and treatment approaches of one or more cultural groups. Traditional health beliefs will involve explanations for the causes of both health and disease. Healthcare providers need to understand the client's own definition of mental health and illness. Oftentimes, these definitions will relate to their cultural practices. A naturalistic illness is said to be caused by impersonal factors without regard for the individual. The personalistic or personality illnesses, these are considered as aggression or punishment that is directed toward one specific individual. The thought of stress can be associated with very culturally defined roles. For example, crying and screaming and displays of emotion are in some cultures considered healthy, where other cultures expect individuals to be quiet and have unemotional responses when they are dealing with stress. When thinking of cultural assessments, as a nurse, we are to be culturally competent. There is no way that one individual can understand everyone's culture. So for us, cultural competence is continually learning about the cultures of the patients or the clients that we care for. And we work on developing therapeutic methods depending on the culture that we are dealing with. We strive to provide culturally competent care, and we attempt to use culturally sensitive therapeutic communication as well as interventions. Oftentimes, being an active listener is the role of the provider when assessing someone's culture. When assessing verbal and nonverbal communications, we look at the method of pronunciation, the rate of their speech, the volume of their speech, whether or not they use touch, how they perceive touch. We also need to consider space and the use of silence, and consider eye contact and facial gestures. For environmental control, this does include an assessment of the patient's or the client's cultural health practices. How do they define good health? And how do they maintain good health for themselves? Related to space, this is an area that surrounds the actual individual. It is their own wall of protection. Everyone consciously maintains their own level of comfortable distance from each other. We know that space comfort levels can be divided into 4 specific distances. One is public, which is approximately 12 feet from the individual. We have social distance, which is greater than 4 feet to 12 feet. We have personal distance, which is greater than 1.5 feet to 4 feet. And then we have intimate distance, which is right inside of that person's comfort zone or their own personal area. In America, there are many middle-class families that live within a nuclear family that consists of parents and 1 or more children. Yet there are many cultures within America that extend the family unit, that includes their aunts, uncles, grandparents, cousins. When doing a cultural assessment, it is important to consider the gender role for the individual. A gender role is just an expected behavior based on the gender of the individual. Oftentimes, women take a more passive role, and men are more outspoken than women in many cultures. In America, the woman tends to be more assertive and outspoken due to oftentimes being a single parent. We need to consider religious beliefs when we're doing a cultural assessment, because religious beliefs and practices often binds individuals to a belief system, and it can oftentimes help explain something that is unexplainable by any other method. When considering biologic factors, we know that a genetic makeup largely is determined by the racial group of the individual. This will determine physical appearance, the metabolic activities, susceptibility of diseases. Remember that a cultural assessment tool permits us to understand how our clients perceive and cope within their own worlds. Many of these cultural assessment tools will include communication, environment, space and territory, time, social orientation, as well as biologic factors. The narrative summary listed on this slide is referred from box 4.2. This cultural communication assessment is referred from box 4.2. And when you're looking at language, we need to consider how someone pronounces words, their quality of speech, rate of speech, their volume, the music that they like, their form of language and the way they write it, whether it's formal or regional. Are they able to communicate their emotions? We need to consider their use of touch and how they perceive touch. And then we look at their space, the territory that they consider personal space, as well as distance zones. We also look at how silence is used and eye contact is used. Many cultures do not permit eye contact because it is a sign of disrespect. And we need to understand how someone communicates their emotions. When we are culturally competent, we attempt to deliver client care that is based on the knowledge of the client's culture. Considering refugees, we know that oftentimes these individuals will have a traumatic history, and because of this, they have higher incidences of mental disabilities or mental illness related to depression, anxiety, and stress. And we need to make sure that we understand what the individual has gone to flee their home. Just recall that everyone from other cultures evaluates their own health care in a different fashion.